Starting today, a federal trial program aimed at making some popular weight loss drugs affordable for older adults starts. So joining us now, Natalie Powers. She's a pharmacist and director of clinical programs at Kinney Drugs. Good to see you here. Thanks for being in the studio with us. Appreciate it, Natalie.
Thank you so much for having me.
So the first question I have to ask you is, why do we even need this kind of, they're calling it a bridge program for Medicare patients to be able to afford these three specific drugs? But why do we even need it in the first place?
Yeah, so that's a great question. So up until today, Medicare patients could not receive GLP-1 medications for weight loss exclusively. So Medicare would cover these GLP-1 drugs for certain medical conditions, but not weight loss. So the Centers for Medicare and Medicaid Services, or CMS, have created this GLP-1 bridge program. So it is a temporary program that's going to run for the next 18 months to allow patients to receive these GLP-1s for weight loss exclusively. And then hopefully that can create other plans following suit in the future.
I got to imagine Medicare is complex and would take a major effort to get things changed. So this is, like, it sounds like a bridge to get them covered for now. You talked about it a little bit there, but let's go a little bit deeper as to what drugs, because it's not all the weight loss drugs out there, right? Is it three specific ones?
Correct. Okay. So you might hear lots of different GLP-1 names out there. So the drugs that are covered on this program are Wegovy, so that comes in an injection and a tablet. Okay. Fundeo, which is a new tablet formulation, as well as Zepbound quick pen injections. So these three medications are the GLP-1 medications that will be covered on the program. So these are going to be offered at a $50 copayment once a month.
Oh, okay. Who is eligible now? Is it everybody that receives Medicare, or who is eligible for this GAP program?
It's a great question. So patients using these medications exclusively for weight loss will be covered, and there is three different buckets for eligibility. Oh. So that first bucket is if you have a BMI of greater than or equal to 35, automatically eligible. If you fall into the second bucket, that's going to be a BMI between 30 and 35, and you have to have a condition such as heart failure, uncontrolled blood pressure, or chronic kidney disease. Okay. Then there's a third bucket for BMI between 27 and 30, and the condition you have to have for that is prediabetes or a past history of heart attack, stroke, or peripheral artery disease.
Okay, gotcha. Seems like it covers a pretty good swath of people, though.
Yes,
by the sounds of it.
Yes.
I'm guessing it doesn't cover everybody, though. So who is not eligible for this particular program?
Exactly. So, correct. So Medicare Part D will continue covering patients with certain medical conditions, such as type 2 diabetes, obstructive sleep apnea disease, as well as fatty liver disease, and there's a couple other indications. So those patients that are not using it exclusively for weight loss, they're using it for a health condition, they will be covered under their Medicare Part D plan and not covered under this bridge program.
Okay, gotcha. I think one of the bigger questions people always ask, how do I enroll in it if I fit into one of those three buckets that you talked about at the beginning there, or is it kind of an automatic thing? What do I do?
Yeah, no, that's a great question, and we're fielding lots of those questions at Kinney Drugs, of course, as you can imagine. So what happens is you will first want to have a conversation with your primary care physician or your cardiologist to make sure that these medications are right for you, and then what happens is they can send the prescription into us at the pharmacy. So we will then determine if we need to put it under Part D for a medical condition or through this bridge program for weight loss. So if we put it under that bridge program, then it's going to require a prior authorization on the very first fill, just to make sure you fall into one of those buckets. If you do within 72 hours, that's going to be approved at the pharmacy, and we can fill it. And you don't have to do that every month. Once you're approved for the bridge program, it will be $50 a month for one of those three drugs we talked about, and you won't have to repeat that authorization.
So no going to a website and trying to fill out all this information. Really just the simplest thing to do is start with your primary care physician.
Exactly.
Okay, gotcha. Yeah. And I know you mentioned it, but I just want to hit it maybe one more time. So if I'm on one of these already, for the most common things often are diabetes, right? That is a separate part of Medicare that is already taken care of. You wouldn't fall under this $50 a month copay for those three drugs, right?
Exactly. Okay. So if you're currently taking that medication, if you've been on the medication, this is going to be covered by Part D. This bridge program is only to expand access to these medications for weight loss exclusively.
30 seconds left. I'm going to ask you this one. Do you think there are people that could use this who who have chosen not to because they simply can't afford it. And so this opens it up to many more people who would benefit by it?
100%.
Yeah, okay.
We see it all day, every day.
Okay.
Patients who receive a prescription, it's not covered by Medicare. These products are hundreds to thousands of dollars for a 1-month supply. So this program is certainly going to increase the access to these important medications.
Natalie, such great information. Thank you so much for stopping by. Really appreciate it.
Thank you so much.